Hey, everybody. We are live on social media, Facebook, LinkedIn, and YouTube, talking about Breast Cancer Awareness Month. My name is Chris Mills. I am Media and External Relations Specialist here at Mary Free Bed, and we've got a great guest from our Cancer Rehabilitation Program, Cynthia Tan. Why don't you introduce yourself and just tell us what you do here at the hospital?
Hi, I'm Cynthia Tan. I am a physical therapist. My specialty is in lymphedema and in oncology rehab.
And we are recording in outpatient here at the hospital. We are in the activities of daily living apartment. So we're just kind of right down the hallway from where you see patients. And you can see around us, we've got a bed where therapists will be helping patients get in and out, practice those activities when they're ready to get home, or maybe they've already been home, they're working in outpatient. You can see some of the kitchen stuff behind Cynthia over there. Just one of the many things our outpatient team has as a resource to help with patients. Yeah, so it's Breast Cancer Awareness Month. We are talking about how patients can work with rehabilitation. And Cynthia, you've been here at the hospital for a while working with patients. Why might someone need rehabilitation after a cancer diagnosis?
Well, while they're going through, uh, their cancer treatments, surgery, chemotherapy, radiation, they all have side effects. So those are the things that we would help with the patients. So one of the side effects is fatigue. Helping them to get stronger and to stay active is really going to help them get through their treatments. Another one is uh, pain or numbness, and that could be due to the surgery or due to the radiation therapy. And we help to improve their range of motion. We help them improve their strength, posture, gait, balance. Those are all things that we work with. My specialty is in lymphedema. So I work a lot with patients that have swelling in either their breast area or their arms.
What is that like, though, as a physical therapist and working within cancer? How might you work with somebody after like a breast cancer treatment, whether they're at the beginning or towards the end? What does your work look like with them?
So if they're just starting into their diagnosis, then what we do is teach them a lot of be proactive, keep busy, stay, do your exercises, try to get 30 minutes of moderate activity every day. While they're going through treatment, if they're going through radiation, they might have some limitations in getting into their radiation position. So my goal is to help them work on getting their range of motion for their shoulder back, or if they have swelling, to decrease the swelling. So physical therapy, occupational therapy, speech language pathology, we all help to keep the patient going throughout their treatments before, during, and after.
And there's times where I feel that patients might be a little hesitant about going to see a physical therapist. They think, "Oh, I can just do this at home." What would you might say to somebody just to encourage them to say, like, "This is really gonna help you in your recovery. You're gonna get back sooner." Why is physical therapy so important that can help them?
Well, I think it's just another avenue for them to help them recover sooner, get them back to their independence, their better quality of life. Um, Going through these treatments for their cancer can cause them to be behind the eight ball, I call it. So we just help them get to their normal sooner, quicker by encouraging them and helping them and guiding them.
What are some of the unexpected hurdles that they might face? Doctors, as they get that diagnosis of cancer and they're being prepped on what the treatment's going to be, the radiation or potential surgery. But what are some of those unexpected things that might come to them in their journey, maybe towards the end of as they think like, okay, I'm recovered, I'm done, but cancer isn't done with them yet.
They they might well, I think they realize that when they're done with the radiation, they should be done and they should feel better right away. And it's not that way all the time. They need to have somebody maybe remind them that it does take a little bit of time to recover. It's a little bit easier when you have somebody to hold their hand. A physical therapist does that by telling them that they can continue to do their exercises, continue doing their activities of daily living, but will help you to do it better and with without having a limitation in their range of motion. It's not okay to have limitations after treatment. We can get you back to almost normal.
One of the things you work with a lot is lymphedema, and that's something before I worked in healthcare never heard of. Can you walk us through what is lymphedema and who are some of the people that might come across that or have to learn how to manage that in their new journey?
For breast cancer patients, um, when they have surgery, they'll have the tumor removed either through a mastectomy or a lumpectomy. And then they also have lymph nodes removed at the same time to see if the cancer has spread. And when they do that, if they get 4 or more lymph nodes removed, or it's a rather large mass, and they have some other comorbidities, it may cause lymphedema. Restrictions in range of motion also can cause it. Uh, Increase in BMI. So my goal as a physical therapist is to help reduce the chance of lymphedema and to help if you do have lymphedema. So lymphedema is when you have an increase of fluid buildup underneath the skin due to the circulation of that lymph fluid not being able to move out of that arm or the breast area. So my goal as a physical therapist is a thing called complete decongestive therapy. And that is 2 parts. One is to do a manual lymph drainage, which helps to move the fluid out of that area and return it back to the lymphatic system. And then compression bandaging, which is bandaging the arm from the fingertips to the armpit to decrease that swelling. And so we teach the patient, we teach their family members how to do the lymphatic massage and the bandaging so that they can continue to decrease it on their own when they're not with us. And then we also teach them a lot of exercises as well.
Yes, physical therapy is something that you work with the experts here at the hospital, but then you are bringing it home. And it's just like any part of life. It's about practice. It's about consistency. And so you're helping people to manage it. What's that like? Is it hard sometimes to encourage people like, hey, have you been doing your homework? Have you been doing your apps? Have you been consistent? Like, how do you like help push those people along sometimes?
It's lymphedema is kind of a nice thing because I can get them to reduce their swelling in one visit. So that encourages them to continue doing it. So the other great thing is that I see them 5 days a week. So I see them for maybe 10 visits and I see them on a daily basis, regular basis. And I really help them to become very independent on their own. I don't like show them and then leave them. I encourage them and I tell them jokes and I give them all kinds of little helpful hints as to how to take care of it themselves.
And that's actually shorter than I expected. I know a lot of times when patients are in physical therapy, they are going for weeks or maybe months. But you said you're seeing them 5 days a week for 2 weeks, and that can really help bring it down and manage it.
Yeah, it can go longer depending on how severe the swelling is, but usually about 10 visits it takes for them to become independent with the massage, their bandaging, their exercises, and getting that swelling down. But if we need to, we'll take more time with them.
Cynthia, have you had any recent patients that you've worked with that you've really connected? I know we've seen you in some of the photos here with some of the patients, but anybody or any recent success stories that really help inspire you and keep you motivated?
There's one that just finished, and her name's Paula. She's great, and she had a wonderful experience here at Mary Free Bed. So she's fantastic. She was working with Dr. Smith as well as the rest of our department. So yeah, we've had quite a few successes. Most of my patients do very well.
Well, you totally set me up for that. So we got a little clip here. If you've been on our social media page, you might have seen this video already, but I'm going to show a little clip of Paula's story and her journey here at Mary Free Bed, just to kind of hear from her own voice. And she's actually sitting down and talking with
the day
Dr.
I
Smith.
got the diagnosis, the surgeon came in. When she told me to go home and spend time with my family, I knew what that meant. But on the other hand, I never believed it. I just did not think it was possible to feel better. And I was very wrong. After all the help I got, I did feel better.
I think when we can celebrate the victories and somebody improving their functional mobility and independence, going home, that's why we're doing this. And that's why I advocate for what we're doing. Because we can't We can't unfortunately change the cancer diagnosis. We can't change some of the treatments or the side effects. But what we can change is people's quality of life. We can change their function, and we can make an impact in that way so that you can do the important things in life. And remember, that we're all human and we have things that are meaningful to us and that bring us joy. And so getting patients and families to that point is the ultimate graduation for us. That's the restoring the hope and freedom that we want to get to.
Well, thank you. You sure did it for me.
Yeah.
What's that interaction like? That connection you make with a patient and you're helping them, you can see the change that you're giving them, inspiring to think of something they weren't able to do, but now they're able to. How does that fill you up?
It's such a great feeling of accomplishment, that they're able to do something that they didn't think they could do before. Um, Cancer is such a life-changing diagnosis. To give them back something that they didn't think they could do before is amazing. And it's a great feeling to help them. I love that.
And that's been awesome, Cynthia. And we've been talking to Cynthia Tan. She is a physical therapist here at Mary Free Bed, part of our Cancer Rehabilitation Program. She is just one of the many team here. We've got a picture here from our website, maryfreebed.com/cancer. You can see some photos of some of our physicians that are specially trained in cancer rehabilitation. Dr. Megan Smith was one who was just in that video that was there. Cynthia, you probably work a lot with Dr. Kaplan. She helps out so much with the lymphedema, and I see her a lot checking in with your patients there. So Cynthia, why is it important for us to talk about cancer rehabilitation, not just during Breast Cancer Awareness Month, but all times of the year?
Well, cancer doesn't stop for holidays and it doesn't stop for vacations. It's always there, unfortunately. So we are here for these patients, and we are able to help them at the beginning of their diagnosis, during their treatments, and afterwards, because it's something that will always be with them, and they're always fearful of a cancer reoccurring. But we're here to help them and to guide them and make them feel better in every way.
If you or a family member are going through your own cancer journey, Mary Free Bed can help with work with you at any part of your recovery journey. So if you are looking for some information, you can, or like to schedule an appointment, you can give us a call at 616-840-8005, or you can go to maryfreebed.com/cancer. You can get some information there. Cynthia, before we go, I want to ask you another one. I've learned so much about this from working with you and other patients, but what are some myths about a cancer recovery? Is there anything you'd like to try to dispel or kind of clear up for people as they're maybe starting this journey?
So it used to be a long time ago, when you got a cancer diagnosis, they said, don't do anything. Don't exercise, sit on the couch, be a potato. It's not true. Studies have shown that if you are exercising, staying active, and staying busy, you actually do much better, quicker, getting back to your quality of life, improvement in your quality of life, and improvement in returning back to your normal, independent self. So we always encourage you to continue exercising, whether it be just going for a walk, strength training, going up and down stairs. Will make it easy for you to accomplish your goals and get back to your normal, independent self.
Awesome. Once again, Cynthia, I just want to thank you so much for chatting with us. We've been talking during Breast Cancer Awareness Month, talking to one of our team from our Cancer Rehabilitation team. Coming up, I want to let you know about an event for more education. It is the Cancer Rehab Education Wellness quarterly workshop. So this is a partnership between Mary Free Bed Rehabilitation, our cancer rehabilitation docs and physical therapists, just our whole team, partnering with the Gilda's Club of Grand Rapids. So it's a quarterly workshop series where we're sitting down. Our experts are going to sit down with family members, patients, anybody who's interested in learning about cancer rehabilitation and how they can get some help during their cancer journey. It is going to be Thursday, November 2nd from 6 to 7 p.m. over at Gilders Club Grand Rapids on Bridge Street. So we got some information on our screen. You can go to maryfreebed.com/cancer to find some more information. So just want to let you know about that event. We might have another call online here with some of the team over at Gilders Club to talk more about that event. So Cynthia, thank you again so much for doing this. Anything else you'd want to add, or inspirational words to the people out that are watching that are going through their cancer journey?
You are never alone. We are always here to help you, either just to listen to you or to help you improve your daily activities and quality of life.
Awesome. Well, thank you again, Cynthia. Thank you, everybody, for watching. Once again, if you'd like some more information, go to maryfreebed.com/cancer. Thank you for watching, and hopefully you can help spread the word, share this video online about Breast Cancer Awareness Month, and we appreciate you all watching.